Good afternoon. Our first item of business today is portfolio questions, and we start with question number 1 from Mary Evans.
To ask the Scottish Government whether it will provide an update on what is being done to tackle mental health stigma and discrimination in the workplace.
Minister Maureen Watt.
Thank you, Presiding Officer. The Scottish Government provides £1 million per year, along with £500,000 from Comic Relief, to fund CME, Scotland's national programme to end the stigma and discrimination that can be associated with mental illness. CME delivers a CME in Work programme to support and enable employers in Scotland to create a mental health friendly workplace where staff feel safe and able to talk openly about mental health and support employees experiencing mental health issues to access their rights. The Scottish Government also provides funding to NHS Health Scotland to provide programmes specifically targeted at workplace settings, including Healthy Working Lives and Work Positive. Workplaces sign up to these programmes. Between April 2016 and November 2016, mental health workplace one-day courses were delivered to 418 people and 221 businesses. Between April and November 2016, 7,921 people have accessed this online resource. This was the first year this online course has been actively promoted to employers. There has been mentally health workplace training for trainers courses to 34 trainers and 16 businesses, which qualify those attending to deliver the mental health at work course at local or business level. Work positive courses were delivered to 113 people, 80 businesses, to allow them to use the work positive resource in their businesses and identify the work-related issues that are causing stress to staff.
Mary Evans.
I thank the Minister for that response, and I ask that question because I've had a number of cases recently where people taking antidepressants, for example, have either been prevented from entering into other sectors of employment or progressing in their own careers. So I think this is a very important issue. But further to that, a study by the Mental Health Foundation last year found that 1 in 6 adults had reported symptoms of a mental health condition in the period from 2012 to 2015. And further to that, 20% of adults reported symptoms of depression in 2014 and 15. Statistics in that report also show a link between deprivation and depression. While the statistics are alarmingly high, what can be done to encourage those who are afraid by the perceived stigma attached to mental health issues to speak up and to seek help?
Maureen Watt.
Well, I would say to Mary Evans and to anyone in the chamber that we should all encourage people to talk openly about how they're feeling, and to any person who is experiencing depression or any other mental health problem to come forward and seek support, for example, from their GP. GPs are well placed to advise and guide patients regarding appropriate treatment or management of symptoms. Out-of-hours support is also available from NHS 24 through Breathing Space or from the Samaritans. Regarding stigma associated with mental health, as I said in my first answer, we fund the CME programme. And we are already seeing the benefit of tackling stigma and discrimination with record numbers of people coming forward for support. And there are other awareness-raising actions that we have taken to break down stigma. But our new mental health strategy will include ways in which we can further have parity, esteem and continue to reduce stigma.
Miles Briggs.
Thank you, Presiding Officer. The Minister will know that Scottish Conservatives have been urging more businesses to introduce workplace mental health champions. Is this something the Scottish Government will look to take forward in the new mental health strategy? And can the Minister confirm to Parliament when that new mental health strategy will be published?
Minister.
To answer Miles Briggs' second question first, the mental health strategy will be published in the coming weeks. In terms of working with businesses, I am engaged with businesses. I think in the coming weeks I've got an event out at Gogarburn with RBS, and I'm sure a number of businesses, not just RBS, will be at that event. So I'm looking forward to engage further with businesses and workplaces as the mental health strategy is published and taken forward.
Question number 2, Alexander Burnett.
Thank you. To ask the Scottish Government what action is being taken to ensure that social prescribing enables GP practices to refer obese patients and people with type 2 diabetes and other medical conditions to third sector support services.
Cabinet Secretary Shona Robertson.
The Scottish Government funds the ALIS programme through the Health and Social Care Alliance Scotland. This online service enables GP practices to connect people to sources of support in the community across the full range of health and care services, including support services for diabetes and weight management. We also fund the Links Worker programme, which is on the front line of the battle against health inequalities. The programme provides a dedicated individual working in GP surgeries to provide one-to-one support to people to address issues such as poverty, debt and isolation, which are making them unwell. Over the next 5 years, we'll increase the number of Links workers in disadvantaged areas to 250.
Alexander Burnett.
I thank the Cabinet Secretary for her answer. She'll be aware that organisations such as Jog Scotland are being used by GPs to help our most vulnerable patients. So how does she feel that these third sector organisations can continue to operate when they're having their budget slashed by the Scottish Government?
Cabinet Secretary.
Well, I'm sure the member will be aware that through the funding from the Scottish Government, through organisations like Sport Scotland, a number of organisations are funded to ensure that their social needs and their needs in terms of physical activity and sport are taken forward. Obviously, in the difficult financial climate, difficult decisions are being made around the funding to particular organisations. However, those discussions will continue to make sure that there is a broad range of organisations out there that people can be referred to. I think where there is scope for improvement is for third sector organisations to come together with community health organisations to have a multidisciplinary team approach, which isn't just about health professionals, but it's also about third sector organisations, whether that's sporting organisations or any others that have the ability to offer something to patients who come through the door, that that signposting and the cohesiveness of that is improved so that patients coming through the door of community health services can be signposted to the right organisation, whatever that organisation is.
Question number 3, Richard Lockhead.
Can I ask the Scottish Government what treatment and support is available to chronic pain patients in the NHS Grampian area?
Minister Aileen Campbell.
It's the role of the Scottish Government to provide policies, frameworks and the resources to NHS boards so that they can deliver services that meet the needs of their local populations. Within this context, it's a matter for NHS Grampian to plan, budget for and deliver the services required to meet the assessed needs of their resident population, including chronic pain patients. In NHS Grampian, we are seeing improvement in patient waiting times, with patients across the region receiving treatment at a pain clinic within 18 weeks, rising from 68% in September to nearly 77% in the most recently published figures. We will continue to support all boards as they continue to work to improve pain services.
Richard Lockhead.
I thank the Minister for her answer. And I'm sure, like me, she can't begin to imagine what it's like to suffer from chronic pain, but there has been some good news she may be aware of, that a pain clinic was recently reinstated at Dr Gray's Hospital in Elgin in my constituency, due in no small part to the patients group that was set up a couple of years ago, AFASER, aptly named, which has been a very effective group for patients in Murray and beyond. However, unfortunately, it's still the case that many chronic pain patients are unable to have procedures at Dr Gray's, such as pain-relieving injections or other treatments, and they have to travel to Aberdeen, which with that particular condition, the Minister will be aware, is particularly problematic and inconvenient. Would the Minister be willing to look at this issue to ensure that the chronic pain patients in Murray have access to the treatment they need, hopefully closer to their own doorstep at Dr Gray's, and will she accept an invitation to come and meet the AFASER group in Murray at some point in the near future?
Minister.
I thank the member for raising this issue. My officials have made an offer to meet AFASER in the first instance to be clear on the issues and concerns that they have. And while I don't think that offer has yet been taken up, I too am happy to meet with the group. I will also instruct my officials to fully look at the issues that the member raises, because while the ISD figures are encouraging and show that there has been improvement around waiting times, Richard Lockhead is absolutely right to raise these local concerns, and for my officials, along with the group, to work together to identify where further improvement can be made. And I'm happy again also to engage with the member on this issue and to keep an eye on progress.
Anna Sarwar.
Thank you, Presiding Officer. There are challenges with chronic pain patients, not just in Grampian, but actually right across the whole of Scotland. NHS Grampian is one of 6 health boards that is failing to meet the 18-week referral to treatment time. Last year alone, 3,227 patients failed to meet the basic standard, half of whom came from Glasgow, despite the government's decision to close the ICC in Glasgow. How can this be an acceptable situation for any patient in a chronic pain situation? What specific action will the Minister be taking? And I note the Cabinet Secretary says that it's misleading. I can reassure the only misleading happening is from the Cabinet Secretary herself.
Minister.
I think we need to correct a number of inaccurate assertions there made by Anna Sarwar. The centre is not closed at all. In fact, facilities, the therapies are still being provided by the Centre for Integrative Care, which are all delivered during usual business hours. He said that I understand that what he said, or what he tried to imply, was that the centre was closed, and that is not accurate. And I'm just, for the record, making sure that the rest of the chamber absolutely understands that. We are the only part of the UK to routinely publish waiting times data on chronic pain, and while there is need to always never need to be complacent on this, there has been improvement made. I set out where improvement has been made in NHS Grampian. There is also national improvement as well. We have given 100,000 though to the University of Dundee to look to capture the data better, so that we can make sure that that story is full, and we understand where we can make further improvement. And the Deputy Chief Medical Officer will also be overseeing and monitoring waiting times to make sure that we can provide that much needed help to people who are suffering from chronic pain, recognising the real stress and strain that that puts on their lives. And I hope that that gives reassurance to Anna Sarwar, who seemed to be a wee bit unaware of some of the facts.
Question number 4, Brian Whittle.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on what action it is taking to ensure that physical activity and sport is available to all, irrespective of background or personal circumstance.
Minister Aileen Campbell.
Thank you, Presiding Officer. The Scottish Government is committed to increasing rates of physical activity. The Active Scotland Outcomes Framework sets out our ambitions for a more active Scotland and is underpinned by a commitment to equality. For example, there are now better and more opportunities for people of all ages and abilities to participate in sport and physical activity right across Scotland, with 157 community sports hubs up and running, increasing to 200 by 2020. Over the past year, Sport Scotland has worked with 5 local authority partners to provide additional support to identified hubs within the bottom 5% of the Scottish Index of Multiple Deprivation Areas. Sport Scotland plans to expand the support to 8 partners.
Brian Whittle.
I thank the Minister for that answer. Now, the Minister and our Government talk about their desire to close the health inequality gap and focus on preventable health, yet it's by their actions that they should be judged. Jog Scotland, free to participate for all, 40,000 people per week and growing, 80% of them women, 70% of whom were previously inactive, has now had its funding withdrawn by this Government. Then we find out that it is deemed so important to the prevention and treatment of mental health issues that SAMH are prepared to pick up some of the tab to keep it going. They understand that it's far more effective, both treatment-wise and cost-wise, to engage sufferers and potential sufferers in this way. If a mental health charity recognises the importance of this approach to the prevention agenda, why is it the Minister and her Government refuse to learn this lesson?
Minister.
Sport Scotland has provided Scottish Athletics with a one-off payment of £65,000 to help Jogs Scotland. So I hope the member recognises that, and of course we'll continue to look to see where we can further enhance the offer around the country to ensure that more people become more active. Now, Brian Whittle does come repeatedly to this chamber weekly and is critical of this government, holding us to account. That's the right thing to do, and that's part of the normal democratic process. But when he comes repeatedly to this Parliament, representing the Tories and asking us to do more to help with equality and to help the vulnerable, it sometimes, I think, always sounds a wee bit hollow, because it's this government is having to also... It's this government that continues to have to mitigate and soften the blows brought about by his government, their approach to austerity, their approach to welfare reform. And on top of this, we have, as a government, so on top of all that work that we have had to do to mitigate the welfare reforms, the austerity measures that his government continually do to punish the most vulnerable in our country, on top of all that spending, this government, since 2009, has invested over £800 million in sport and activity. So we'll continue to work hard and work on our record of providing opportunity to increase and encourage activity for everybody across the country. And we'll take absolutely no lessons from the Tories on this.
Ivan McKee.
Can I ask the Scottish Government what progress has been made on the implementation of the SNP manifesto commitment to a network of regional sports centres?
Minister.
I thank the member for the question there.
Order. Let's hear the Minister.
Disrespectful.
Yeah, thank you. I do appreciate the question that Ivan McKee has raised, because he's absolutely right to raise our SNP commitment to a network of regional sports centres. And it's important to recognise that sports facilities right across this country have the best that they have ever been, due to the collaborative approach taken right across the whole sporting systems. Now, Presiding Officer, I hear a lot of the members trying to heckle me while I'm speaking, but I think it would be appropriate for them to listen to the answer to some of the points I'm trying to make. Sports Scotland remain committed to working with its partners in developing a network of national and regional facilities where people can get involved in sport, whether that's in school, and education, club or community, or performance environments. And we've already seen the Orium, the National Performance Centre for Sport, open its doors in August last year. The National Parasport Centre will be opening shortly, and the new National Curling Academy at the Peak in Stirling is well underway and due for completion later on this year. So I hope that gives a bit more of a flavour about the continued effort to ensure that our facilities in Scotland continue to be among the best.
Question number 5, Jamie Green.
To ask the Scottish Government what its response is to the recent Samaritans report, which recorded a disparity in suicide rates across all local authorities.
Minister Maureen Watt.
Presiding Officer, any death by suicide is a tragedy. Sadly, the link between deprivation and risk of suicide is well known, as is the variability of suicide rates from one locality to another. We will take this report's recommendations into account, including placing emphasis on inequalities as we develop a new suicide prevention strategy for publication early next year. In Scotland, although suicide rates are higher than average in the most deprived areas, it is important to recognise that this inequality gap has narrowed over the past decade. Scotland's overall suicide rate has fallen by 18% over the last decade or so, and the number of deaths by suicide in 2015 was the lowest in a single year since 1974. From our discussions with a range of stakeholders, including Samaritans, it is clear that there is a perceived need to refresh and invigorate local suicide prevention action. This will vary from area to area, depending on local circumstances and local needs. This is something to which we will pay particular attention in the development of a new suicide prevention strategy.
Jamie Green.
I thank the Minister for that response. The Samaritans report highlighted that a person living in a deprived area was 3 times more likely to commit suicide than someone living in an affluent area. In my own region, Inverclyde has the highest rate of suicides in any local authority in Scotland. But the causes and reasons for suicide are varied. For example, figures released by the TIE campaign last year showed that a quarter of our LGBTI community had attempted suicide at least once, a statistic which shocks and deeply saddens me. So can I ask the Government what actions it will take to better identify and improve outreach with people both in high-risk areas but also high-risk categories?
Minister.
I thank Jamie Green for his question. He raises a very important part that a suicide prevention strategy should take into account all those different activities and these different problems in each and every area, not just in terms of the area, but also in terms of local groups, including the LGBTI community, whom we know suffer from particular mental health problems, an issue which will be addressed in the mental health strategy, but will also be taken forward in the suicide prevention strategy. But I thank him for his question.
Monica Lennon.
Thank you. The Minister will know that I raised this report with the Deputy First Minister during First Minister's questions last week, and I'm grateful that my suggestion of an evaluation of the previous strategy will be considered. So I look forward to a further reply from the Minister in due course on that. The Samaritans report also stresses that cross-governmental, cross-department cooperation is required in approaches to suicide prevention, and that development of all welfare, housing and employment policies should include an evaluation of potential unintended impacts on mental health and suicidal behaviour. Is this something that the Minister will consider in the next suicide prevention strategy? And what assurances can she give that her office is working in coordination with other government departments to tackle and prevent mental health challenges?
Minister.
I can assure the member that this government works across portfolios on all aspects of government. I'm very well aware that in terms of improving the health and the mental health of the nation, it isn't just down to the Minister for Mental Health or indeed my colleagues in the health portfolio, but obviously in terms of housing and communities ministers and education and many others, including the environment, for example. So we're all in this together.
Question number 6, Jeremy Balfour.
Thank you, Presiding Officer. To ask the Scottish Government what it is doing to encourage more women to regularly participate in sport.
Minister Aidan Campbell.
Thank you. The Scottish Government is committed to increasing rates of physical activity for everyone in Scotland, and our ambitions for a more active Scotland are underpinned by a commitment to equality. My strategic guidance letter to Sport Scotland emphasises the importance the Scottish Government attaches to equalities, and our programme for government included a number of commitments which are being taken forward. These include a 300,000 Sporting Equality Fund aimed at increasing the number of women and girls participating in sport in Scotland, of which details will be announced shortly. Scottish governing bodies of sport are doing good work on the quality standard for sport. Cricket, snow sport and karate are excellent case studies of governing bodies taking steps to increase diversity on their boards, create increased opportunities for participation for women and support for coaches and role models. And I'm delighted Sport Scotland is the latest public body to achieve gender equality on its board following the appointment of 5 new members last month.
Jeremy Balfour.
I'm sure the Minister will be aware of the findings of a survey carried out by the Health and Sport Committee as part of its inquiry, Sport for Everyone, that shows that non-participation in regular sport and physical activity is higher among females than males across all age categories. Can I therefore urge the Minister to focus on barriers to sporting participation uncovered in the survey, including caring and family commitments, feeling of self-consciousness and negative experiences at PE at school? What considerations will she give to how more women can get involved regularly in sport?
Minister.
And Jeremy Balfour is absolutely right to raise this issue, and it's one of the issues and areas that continue to be a challenge about how we get women and girls more active. And non-participation, as he rightly points out, is higher amongst those cohorts. And he's right also to point out the multiple layers of barriers, potential barriers, that we actually have to, he's right as well to point out that we need to work hard to try and unpick and understand and to overcome as well. Sport Scotland has identified equalities and inclusion as a key priority in its corporate plan, and they are taking forward our programme for government commitment are also establishing an Equality in Sport and Physical Activity Forum to take forward the recommendations on broader equality issues in the Equality in Sport research. But I think he's right to raise this issue, right to continue to put pressure on this issue, and that's why my strategic guidance letter also emphasised the importance that we attach to equalities.
Kenneth Gibson.
Thank you, Presiding Officer. Can the Minister tell the Chamber what an impact she anticipates, particularly in women's sporting participation, and not least para-sports participation, from the £12 million, half of it from this government, currently being invested in the unique new state-of-the-art sports facilities at Sport Scotland's National Centre Inverclyde in Largs, which we both recently visited?
Minister.
The National Centre will be a first for Scotland and across the UK, and it's something that I think we should all feel very proud about. It was good to get an opportunity to visit along with the constituency member in Largs and to see how much attention to detail has been placed on ensuring that that can be a facility for absolutely everybody, regardless of their physical abilities. And so we should feel very proud. It will be opening soon, and it will, I hope, increase activity for disabled people who have an interest in sport and activity, but is also very much determined to be a community asset and a community resource, and to provide opportunity for girls and boys, men and women, young and old, across North Ayrshire and beyond.
Question number 7, Ruth Maguire.
Thank you, Presiding Officer. To ask the Scottish Government when it last met NHS Ayrshire and Arran and what issues were discussed.
Cabinet Secretary.
Ministers and Scottish Government officials regularly meet with representatives of all health boards, including NHS Ayrshire and Arran, to discuss matters of importance to local people.
Ruth Maguire.
I thank the Cabinet Secretary for that answer. Since the publication of the Scottish Government's National Drugs Strategy, The Road to Recovery, in 2008, This government's taken a strongly recovery-focused approach to the problematic drug and alcohol use. In my own constituency, the North Ayrshire Alcohol and Drug Partnership has cemented its reputation as a leader when it comes to recovery, with countless local successes, including Café Solace and the Funky Films project. I welcome the Scottish Government's new Partnership for Action on Drugs in Scotland, launched in January of this year. One of those top 3 priorities was listed as building communities focused on recovery and tackling stigma. Could the Cabinet Secretary provide an update on the work of the partnership, in particular the development of the priorities and work plan through the themed groups?
Cabinet Secretary.
Well, I can tell the member that good progress is being made by the Partnership for Action on Drugs in Scotland, PADS, and its subgroups in tackling problem drug use through reducing harm, embedding quality and consistent services, and developing recovery-centred communities. The Minister for Public Health and Sport attended the PADS meeting on the 8th of March, which focused on 2 of its priorities, the Harry Burns Review and children affected by parental substance misuse. The Scottish Recovery Consortium, funded by the Scottish Government, are working alongside PADS to ensure recovery and lived experience is at the heart of its work. North Ayrshire is a leading ADP which continues to exceed the national LDP waiting time target and has implemented a number of recovery-focused initiatives, including 2 recovery community cafes, with a 3rd site due to open shortly, and 9 smart recovery meetings embedded across North Ayrshire, and I would pay tribute to the work that they're doing.
Colin Smith.
Thank you, Presiding Officer. In November last year, the Cabinet Secretary promised the parents of 6 babies who tragically died at Crosshouse Hospital in Ayrshire from 2008 and whose deaths were deemed unnecessary, there would be a full official review into their children's deaths. Now, given this promise, can the Cabinet Secretary explain why 5 out of 6 of those families have discovered that the review by Health Improvement Scotland will not look at their children's cases in detail, as their deaths occurred before the end of 2013? Will the Cabinet Secretary intervene in this matter and ensure that the cases of all 6 families, including those babies who died between 2008 and the end of 2013, will be given the same full and official review that they were promised and deserve?
Cabinet Secretary.
Well, can I say to the member, this is an important matter. I should also say, of course, that the HIS review is independent. HIS have said that they have met with all the families who wanted to be involved, but the member does draw attention to the December the 2013 date, which of course was put in place by HIS because of the terms of reference for the review, which was to focus on whether Ayrshire and Arran had adhered to the national framework in dealing with significant adverse event reports, given the previous review, which looked into cases prior to December 2013. So that was the rationale for December 2013 and looking at cases beyond that date, because those cases before that date had already been looked into through the previous review. However, what is important is in the taking forward the review that HIS are able to have further engagement with the families, and I would encourage them to do so, to try to address their concerns. But I think we have to not lose sight that the review was established for a specific reason, and that was to look at whether or not Ayrshire and Arran had adhered to the national guidance in dealing with significant adverse event reports since the previous review. However, I have encouraged HIS to have further engagement with the families to hopefully address some of their concerns.
Question number 8, Alexander Stewart.
Thank you, Presiding Officer. To ask the Scottish Government what support is in place to assist people who have had a stroke with their recovery and in becoming as independent as possible.
Minister Aileen Campbell.
Thank you. Stroke remains a clinical priority for the NHS in Scotland and the Scottish Government. The Scottish Government recognises the importance of recovery from stroke. The Scottish Government Stroke Improvement Plan, published in August 2014, includes priorities in supporting self-management and rehabilitation. It is up to individual NHS boards to deliver the level of stroke services required in the area, depending on local and individual need. Boards are responsible for delivering stroke care services via their stroke-managed clinical networks. The Scottish Stroke Improvement Team supports managed clinical networks to implement local action plans to improve the delivery of stroke care across Scotland.
Alexander Stewart.
I thank the Minister for her response. The charity Chest, Heart and Stroke Scotland have raised concerns that NHS provision of rehabilitation for people recovering from strokes and a long-term condition often end far too soon, and returning home people are left without vital ongoing support. What will the Scottish Government do to ensure that across Scotland there is a consistent pathway of rehabilitation available from the NHS through to community support?
Minister.
Well, we are seeing improvements across the country, but we'll always take cognizance where people and organisations and groups have concerns. We have started to collect data on rehabilitation, and from November 2015 to January 2016, a rehabilitation sprint audit was conducted, and a second pilot is planned for Monday the 23rd of January to Sunday the 2nd of April 2017. So there's ongoing analysis and data capture to see where we can make improvements. Of course, this is also related to ensuring that we have the full integration of health and social care, to ensure that the right care packages are in place, to ensure that people who have suffered a stroke can get the right help that they can need in the right way at the right time.
Question number 9, Polly McNeill.
Presiding Officer, to ask the Scottish Government how the NHS tackles health issues resulting from cold homes and fuel poverty.
Cabinet Secretary.
We know that health inequality is closely linked to income inequality, and that's why the Scottish Government is committed to tackling poverty, including fuel poverty, as a priority. We recently published a Fairer Scotland Action Plan, which sets out 50 concrete actions that will take over the course of this Parliament to tackle inequalities, such as developing referral pathways between NHS services and local services to maximise the income of patients, tackling the poverty premium and delivering at least 50,000 affordable homes over the parliamentary term. We've allocated over £650 million to tackle fuel poverty since 2009, and as was announced in the programme for government, we'll make available £500 million over the next 4 years, meaning over £1 billion will have been or will be committed by 2021 to tackle fuel poverty and improve energy efficiency.
Pauline McNeill.
Presiding Officer, I thank the Minister for that comprehensive answer. The Minister will be aware that World Health Organization say that 30% of excess winter deaths are caused by cold homes, and that a preventative approach could save £80 million for the National Health Service. The National Institute of Clinical Excellence and Homes Alliance Scotland have recently recommended the energy performance of properties where there are fuel-poor households that they should be improved to a minimal acceptable standard of EPC Band C rating, but ideally Band B rating. Does the Scottish Government support bringing all properties into Band C by 2025? And further, will the Minister, I appreciate that this is a matter that goes beyond our own portfolio, but I wonder if the Minister would give a commitment to agree to discuss targeting the poorest households to ensure that they reach the rating of EPC, which will prevent them from living in a cold home, to eradicate the scourge of living in a cold home.
Cabinet Secretary.
Well, I'll certainly get the Cabinet Secretary to write to Pauline McNeill with some of the specifics that she raises, because they are slightly out with my portfolio, but nonetheless very important issues. What I can say to her, and she'll be well aware of this, is that we're consulting on a new long-term fuel poverty strategy, including proposals for a new overarching target in autumn 2017, and that's going to feed into the development of a new Warm Homes Bill, which we plan to introduce in 2018, and I suspect that will be a further opportunity for Pauline McNeill to raise some of those issues and proposals around the targeting that she's raised here today. But what I will ensure is that a more detailed response is sent to Pauline McNeill in due course.
Donald Cameron.
Thank you, Presiding Officer. Shelter Scotland estimates that 1 in 10 households in Scotland are affected by dampness or condensation, which the Existing Homes Alliance say can aggravate conditions such as heart disease, strokes and flu, and increase the risk of mental health problems. What action is the Scottish Government taking to ensure fewer homes are affected by conditions such as dampness or condensation?
Cabinet Secretary.
Well, further to what I said to Pauline McNeill, as recommended by the Scottish Fuel Poverty Strategic Working Group, we've established an independent panel of experts to review the definition of fuel poverty. The review, due to be completed late summer, will look at whether changes are needed to help us better target our efforts to eradicate fuel poverty in the forthcoming Warm Homes Bill. And I'm sure that the issues that Donald Cameron raises will be able to be explored in terms of tackling dampness and other issues. But, you know, I have to take the opportunity to remind the member that some of the reasons that people struggle with their household bills and paying some of their household bills is due to the welfare reforms. So the Tories might not like to hear the truth, but if you cut people's household budgets through welfare reforms and cuts to tax credits so that people who are in work are poorer, then it's hardly rocket science to establish that they're going to struggle to pay their fuel bills. And the Tories can guffaw all they like, but there is a direct correlation between welfare reform and people's ability to pay their bills, and therefore the consequences of fuel poverty. You can shake your head all you like, everybody else knows that to be the truth.
Exactly. Question number 10, John Scott.
Thank you, Presiding Officer. To ask the Scottish Government whether NHS Ayrshire and Arran's reported under recruitment of 30 consultants will adversely affect on its ability to safely operate the combined assessment unit at Ayr Hospital when it opens in May 2017.
Cabinet Secretary.
NHS boards across Scotland, including NHS Ayrshire and Arran, have a statutory responsibility to carry out workforce planning and must make every effort to fill existing gaps to ensure that services continue to be delivered safely. The Scottish Government works closely with boards to give them the tools they need to improve workforce planning. Under this Government, the number of consultants in NHS Ayrshire and Arran has increased by 62% to over 290 whole-time equivalent. Additionally, in spring of this year, we'll publish our national and regional workforce plan, which will improve workforce planning practice to make clearer what should be planned at a national, regional and local level.
John Scott.
Thank the Cabinet Secretary for her answer, but she will be aware that the welcome opening of this new combined assessment unit will in all probability result in increased admissions to Ayr Hospital. And if experience elsewhere is a guide, how does she envisage such an additional workload being dealt with by already overstretched staff at Ayr Hospital specifically and NHS Ayrshire and Arran generally, when waiting times for first appointments for many disciplines are already among the longest in Scotland?
Cabinet Secretary.
Well, I know John Scott has raised these issues before, and quite rightly so. And it is important that the Scottish Government supports boards like Ayrshire and Arran to ensure that they have the correct staff in place to deliver the services that local people need. As I said, there has been an increase in the number of consultants and indeed other staff, but of course we know that demand has also grown. What's important in workforce planning, whether it's for the combined assessment unit or the rest of Ayrshire and Arran's services, is that they get the right configuration of staff. We will continue to support Ayrshire and Arran to recruit. There are some opportunities, I think, with looking at the recruitment of clinicians to network positions, for example, where clinicians that are really hard to recruit and are specialist in nature are able to be recruited to work across more than one site because it makes those posts more attractive. I'm happy to continue to talk to John Scott about these matters and as we take this forward, and if he wants a meeting to discuss in more detail, I'll be happy to provide that.
Question number 11, Douglas Ross.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to claims that return patients who require regular treatment are not counted in chronic pain waiting times, and what action it is taking to address the reported excessive delays that some face before receiving treatment.
Minister Aileen Campbell.
Scotland is the only nation in the UK to routinely publish the chronic pain waiting times. This is a clear sign of this Government's commitment to making improvements for people living with chronic pain. Chronic pain waiting times data published on the 14th of March by NHS Information Services Division showed an improvement in the number of patients seen within 18 weeks, rising from 60.4% to 64.5% during the last quarter ending December 2016. I recognise, however, that there is more progress to be made, and this Government will continue to support NHS boards to ensure chronic pain patients get swift access to the care that they need. With regards to return patients, such appointments will always be subject to individual clinical assessment.
Douglas Ross.
I thank the Minister for that response. However, she didn't answer my specific question about return patients not being recorded. And she will be aware of reports last week that thousands of chronic pain patients are suffering in what has been described as a hidden national scandal. It would seem that the new chronic pain patients are given priority in a bid to meet the Scottish Government's target of 18 weeks referral to first treatment, but return patients needing regular treatment are not counted. So will she consider including that in future reports? And one return patient who has commented on this is Chris Bridgeford, a pain sufferer from Forres who founded the Murray-based Alpha Fair group, which was mentioned earlier. He is quoted as saying, "We have people despairing of their lives due to the huge delays in treatment. What more can be done to ensure chronic pain patients who require regular treatment in Murray and across Scotland get this treatment when and where they need it?" And given the Minister's earlier answer about meeting with Alpha Fair, could she include all MSPs who cover the Murray area in that meeting so we can continue with the cross-party work that has been so successful locally?
Minister.
In a previous answer, I did set out how there had been clear improvements across NHS Grampian, and that's because we have chosen to be the only country in the UK to publish these waiting times, and that, I think, it does indicate that there is a clear commitment there. And of course there is other ways, though, that we need to make sure that we fully understand the picture, which is why I did mention in my response to Richard Lockhead that we have given 100,000 to the University of Dundee to look at how we can better capture the data and drive forward improvement. It's why the Deputy Chief Medical Officer will also be overseeing and monitoring waiting times and making sure that we get that very full picture about how we can help better people suffering from chronic pain. And I did say that I would meet with Alpha Fair, but my officials have instructed my officials, first of all, to meet with them and to do some work to look at the situation in Grampian, and we'll be sure to make sure that the member gets an update on that.
Thank you. And that concludes